Today, dental implants can stabilize a complete arch in a variety of ways. Several options would include a removable appliance that would actually be supported by dental implants that you can remove. And there are fixed complete arch solutions that are attached to the implants and can be removed by the dentist and not necessarily at home by yourself. But the ability to clean around them is assured. There are several different ways we can replace a complete arch. On the mandible, you can have as little as 2 implant fixtures to support a removable appliance that would clip on and support that denture during function. For the maxillary arch, the upper arch, 4 to 6 implants for a fixed or removable appliance as well. You can have crown and bridge supported by implants, or you can have a denture that will actually clip onto a bar or be fixed to the implants themselves with no coverage on the palate. It improves your ability to speak, it increases your pleasure during eating and functioning, and those options are always available depending upon your presentation. The best time to consider an implant-supported full arch consideration is when the teeth first have to be removed, because the bone is more stable at that point than at any other time. If you wear a denture for a long period of time, the bone can become less dense and resorb or be shortened a little bit and maybe provide less support. It does not mean that you can't have the implant-supported restoration, but it certainly means maybe a compromise or some bone augmentation to allow for that to happen. So the most important thing is, if you're missing your teeth currently and you're wearing a denture, or if you're about to have your teeth removed because of other unfortunate periodontal compromise, that's the time when you want to make a decision to look at your options for an implant full arch supported restoration. It will give you a lifetime of satisfaction.